we're just starting to get our arms around, which may be actually the largest source of error, is diagnostic error. It's not just in hospitals. I mean, most of it is in doctors' offices, and based on studies that have been done, mostly postmortems, we find that 20 to 40% of people who have these postmortems or autopsies had diagnostic errors. Diagnosis is really, really hard. And it's actually getting harder as the diagnostic tools get better. There are a lot of new imaging technologies. There are very sophisticated pathology probes down to the molecular and genetic levels. The average, it's a bad term, average physician, but the usual clinician can't keep pace with that, and often will order tests or not relatively blindly. So another theme of medicine that wants to prevent errors is teamwork. Doctors, they've gone to school 12 years maybe after high school, but they are not universal geniuses. They don't know every drug interaction, every procedure, every diagnosis. It's very, very important, whether they're in surgery or they're diagnosing or they're prescribing, and I'm going to talk about that in a minute. It's very important that they do it as part of a system and in a team, with team members who have the updated knowledge, access to technologies that they don't have. So one of the big problems is we have a fee-for-service medical system. One of the three most hated letters in modern medicine are FFS, fee-for-service. And the reason why that's so difficult is that for Medicare and private insurance, there are no codes for initial consultations with specialists before you actually hire the specialist. Now, this is being looked at very seriously by Medicare and the federal government at least, so that when you go to a doctor and the doctor says, well, it looks like we need tests, or I really can't say myself, before he engages the tests, the contacts pathology or radiology, what have you, actually can just talk to these people, have a conversation. Maybe you can be a part of it, and everybody gets paid. Because if people don't get paid, they don't work. And so there's the three other most hated letters in modern medicine are CPT, current procedural terminologies. And if you don't have a CPT code, you can't get paid. So we need CPT codes that really deal with initial just communications, brainstorming, how to do this. And when we don't do it, we get bad diagnosis or non-diagnosis, and the person who maybe has a bad illness doesn't get treated until too late. It's a big problem. So there are probably up to, and I don't want to seem alarmist here, this is really based on a doctor at Hopkins who studies this and has written about it in the British Medical Journal. His name is David Newman Toker. He's a very smart neurologist, actually, whose main area of study is stroke. But he studies diagnostic error. There may be 500,000 deaths in this country up to 500,000 deaths in this country from diagnostic error alone, which, if that's true, it would make medical error the largest cause of death in this country. And it's very difficult to study. Most of it happens in doctors' offices, not in hospitals, which are even less overseen, less regulated than hospitals. How to get our arms around that problem is now a big source of study in the upper reaches of the medical profession, such as this Institute of Medicine of the National Academy of Sciences is now really studying, starting to put out reports about diagnostic error. We know from autopsy studies and from something called the National Practitioners Database, which is a source of information that's been managed for more than a quarter century by the Department of Health and Human Services, that tracks malpractice settlements and verdicts, that diagnostic error is the biggest source of errors. It's not wrong site surgery, infection, medication error, or falls or blood clots in the hospital. This is it. This is the biggest source. We really don't know yet all the ways to address it, except it does seem that teamwork methods should be applied at that early stage the way they are at later stages, such as surgery.